welcome to my channel. My name is Jazzy RN. If you are new here, welcome. And if you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. I have 9+ years experience working as a utilization review nurse, and I've worked for 3 different companies. So this first company is called Zocala Health, and they are hiring an RN enhanced care management nurse for California. This is a full-time job. The compensation is $80,000 a year. Looks like this is a salaried role, not a hourly. Now first, I always go straight to the qualifications or requirements to make sure I meet those qualifications first. So the qualifications are active RN license in California, 3+ years of clinical nursing experience. This is at the bedside, experience in care management, population health, or community-based care, bilingual in Spanish, experience working with Medicaid or underserved populations. The preferred qualifications are experience with Medi-Cal managed care plans, familiarity with CalAIM enhanced care management programs, and experience addressing social determinants of health, community-based, and care models. Now this job also offers some perks. This one that stuck out to me was the $1,000 home office stipend. And just in case you do happen to get this position, if you were to go to the description box below, I have a link and it's called Cure to Bedside Burnout. If you scroll past all of these companies, these are just companies that hires nurses to work remotely. Most of the companies hire nurses in the United States. Some of these companies hire nurses in Canada, the UK, the Philippines, etc. You want to scroll past all the lists of the companies. This is a link to my Udemy course. It's called Remote Nursing, the Cure to Bedside Burnout. It goes over your interqual, MCG, your resume, as well as the questions you should ask the hiring manager and the HR person and more. This right here is the office essentials. Now, not every item is essential, but I have absolutely all these items except for just one, which is this right here. I use this at home. I like to have this space with the storage under my laptop. So if you go to this site, I actually get a little bit of commission. It's through Amazon, and you'll see a list of items here. So if you decide, if you actually get a stipend for whatever company you work for, you can actually come here to look for items that you want to purchase for your home office. Next, we'll go to the next company, which is WellSense. They are hiring an inpatient utilization management clinician, and I've been a UM nurse for over 9 years. Just an FYI, once more, I'm going to go straight to the qualifications and requirements. You must have an active RN license, unrestricted RN license, and state of residence, nursing degree or diploma required, and bachelor's degree of nursing is preferred. So as you see here, preferred, bachelor's degree, RN license in the state of Massachusetts, New Hampshire, or compact license, Medicare and Medicaid knowledge. This is preferred but not required. The experience is 2+ years utilization review experience and evidence-based guidelines, and WellSense health plan uses interqual, managed care experience performing discharge planning, and all employees working remotely will be required to adhere to Wellness's telecommuter policy. And then once again, active unrestricted RN license in the state of residence. You will undergo a pre-employment background check and ability to take after hours calls, including evening, nights, and weekends. Just a FYI, one more thing about the site, the description box below, and you go to Cure to Bedside Burnout. If you scroll past the office essentials, you'll see some FAQs about questions and answers about working remotely as an insurance nurse. You'll see resume tips. Go past that, you will see the difference in how bedside nursing and insurance nursing is, but how they relate. So a bedside nurse has a patient, an insurance nurse has a member. Both have the same exact diagnosis. And I do want to point out that what you do as a bedside nurse, whether that is you're working as a hospital nurse, you're working as a skilled nursing facility nurse, inpatient rehabilitation, or long-term acute care, what you do and what you document directly relates to what an insurance nurse reviews. The next job is with WellSense, and this is a clinical auditor. This job also requires you to have experience. So down to the qualifications or requirements, they require a bachelor's degree in nursing or an equivalent combination of education, training, and experience required, 2 years of case management, utilization management, claims auditing, or other clinical health insurance role, 2 years minimum RN experience in acute care setting. This is considered working at the bedside. Behavioral health and our DRG experience required, inpatient DRG experience. You must have a valid RN license required, coding certification preferred, CPC or CCS certification, basic familiarity with CPT, ICD-10, HCPCS coding is preferred. We call this HCPCS for short. Just an FYI, as a utilization review nurse, the job I've worked for, the very first one, and every other job after that has taught me all about the HCPCS, ICD-10, and CPT codes. So for ICD-10, that is basically, let's say someone has hypertension, and the ICD-10 code for that is I-10. Every diagnosis has its own ICD-10 code. The CPT codes will be placed on the clinicals or the electronic medical records for the member. Some companies, well actually some hospitals, give the insurance companies access to their electronic health records. So let's say that the hospital uses Cerner or Epic. Each nurse who works for that insurance company will have to fill out a form. That way they can get their own login and password to get access, but it's view-only access of the company's EMR records. We don't have access to make changes and document. We just can view it and do our reviews using InterQual. And then claims processing experience is preferred. The next job is with TimeDoc, and they're hiring a full-time remote care coordinator. This is for medical assistants, CMA, RMA, or LPNs, and the qualifications. Well, I'll start with a work schedule. It is full-time, 40 hours per week. Your coverage will be Monday through Saturday, 8 a.m. to 6 p.m. in a time zone that you support. So you may work in the Pacific time zone, but supporting the Central time zone. Fixed schedule is assigned. There are no alternate shifts available. Expect to spend 7 to 8 hours per day on the phone. Productivity and quality metrics are required and monitored. This job tells you what you'll be doing. So you'll be making a lot of phone calls, 30 to 50 outbound calls a day. Conduct monthly, this is chronic care management phone calls with assigned patients. And this very last one, I won't go through each one. This last one says maintain HIPAA compliance and patient confidentiality. And make sure here where it says create and update personalized care plans in EMR, include the EMR's electronic medical records you have knowledge of on your resume, and so that it uploads to your application. So whatever job you work for now, and let's say you're using Cerner, you're using Microsoft Office, and any other platforms or software as a service, add that to your resume. You want to make sure your resume sticks out as that you're tech savvy. Here's some more requirements. A minimum of 1 to 3 years of experience as a CMA, RMA, LPN, or RN. Active certification or multi-state license for LPNs or RNs. Strong verbal and written communication skills in English. Comfortable being on the phone most of the day. Experience with EMR or EHR systems. That's the same thing. Electronic medical records, electronic health records. Organized, reliable, and able to work independently in a remote setting. And here are preferences: geriatric patient experience, care coordination or case management experience, strong verbal and written communication skills in English. Now your work environment must be private, quiet home office with no interruptions, reliable high-speed internet. They want 100 megabits per second or higher. A second monitor is required, and company laptop and required software is provided. So they will provide you with a company laptop. They won't provide you with a second monitor. So what you can do instead is go back to the description box below, and if you scroll here where it has the list of equipment that says don't forget the Office Essentials, Office Upgrade, it will bring you to this. And if you want to buy a secondary monitor, I do suggest this one. I had this at home and I use this if I'm actually traveling. Let's say I'm going to visit some family and I want to still be working, but I'll just be visiting the family. After I clock out, I use this, as well as this is great for whenever you're evacuating. So let's say you live in an area where there's hurricanes or forest fires, you can actually still work on the go. This device here, it just attaches to your laptop and gives you two additional screens. I believe it's around $200+ when I bought it a couple of years ago. I believe it was maybe $350, but it's gone down since then. The cheaper option is a USB-C, this here, to HDMI cable. It will convert whatever TV you have, as long as it's a newer TV, to a secondary monitor. So this part right here, this USB-C, you place into your company laptop, and this HDMI part you place into your TV. It's the same type of insertion you put for your Fire Stick, and it allows you to use your TV as a secondary monitor. Back to the position, and here are the benefits and perks. So of course you'll have medical, dental, and vision insurance, paid time off and paid holidays, fully remote work environment, supportive team culture with opportunities for growth, career advancement as Time-Doc Health continues to expand, and meaningful work focused on keeping patients healthy and out of the hospital. The next company is Concerto Care, and they are hiring for a market RN in the state of California. They do offer yearly continuing education allowance. I do want to mention here that whenever you work as a remote nurse, the company you work for will provide the CEUs free of charge. The only thing you have to pay for yourself is, let's say, paying for the amount for getting the renewal to whatever state you live in. This company also provides medical, dental, vision, and 401k, and etc. We're going to go straight to the requirements. This job requires, the qualifications are bachelor's degree in nursing and are commensurate, clinical experience, active nurse licensure in the state of California in good standing, or must be willing to obtain a California license upon hire. Unencumbered multi-state license is preferred. Recent telephonic triage, urgent care, or ER, ED experience is required. Clinical experience caring for aging adults and adults with complex care needs required. Advanced training in geriatrics and or palliative medicine preferred. Previous experience with managed care and or value-based healthcare delivery preferred. And average to advanced computer and software skills is required. Make sure you do promote your software skills on your resume. Whatever software or platforms you're familiar with, you want to promote that on your resume. And the wage/salary for this job is $90,000 to $110,000 plus annual bonus. And this company is called Wellbox. Now they posted this job 2 days ago. I couldn't find it on their website, the company site. It was only on their LinkedIn account. So for Wellbox, they're hiring a CMA, RMA, patient care coordinator. And the requirements are must have a clear and active medical assistant certification, that is CMA, CCMA, RMA. Must reside and work in the continental U.S., must have a minimum of 4 years clinical experience, that's at the bedside, experience in care coordination or care management, health coaching, and motivational interviewing is a plus. And I've seen this term motivational interviewing frequently for some jobs. Hands-on experience and comfort with electronic medical records, experience using Microsoft Office products such as Teams, Outlook, and Excel. I do want to give you a FYI that Teams, whenever you are training remotely, most insurance companies, or the major insurance companies, will be training you using Microsoft Teams. And here are the competencies and preferred qualifications. You must be comfortable with technology and software while demonstrating proficient computer skills. I do want to point out that if you are, what kind of learner are you are. I'm a visual learner, so I've made a lot of screenshots using Snipping Tool or Snagit. Now most computers will have the Snipping Tool on the work computers, and not all companies have Snagit. If the company you work for does not have Snagit, you can always ask the manager or your supervisor if it's okay to request snag it, and it will be added by the IT team. But just know that whatever kind of learning skill that you have, you want to stick to that same learning skill when learning this new job that you'll be on, because you'll be working remotely and you're being trained remotely. So there's no one to be around you to help point out things to you right at your right behind your shoulder. You have to actually learn it yourself, as well as ask questions and just know what kind of learner you are. The ability to stay flexible and quickly adapt to new processes, software changes and priorities, understanding healthcare goals, provided by the practice while monitoring, assessing, and recording patient progress against a care plan, exercise, initiative, judgment, organization, problem solving, and decision making. And I'll let you read the rest of these bullet points at your leisure. But this position type and expected hours of work includes full-time, 8 hours daily, that is Monday through Friday, unless authorized by management. The hours may be worked between 8 a.m. and 6 p.m. in the patient's time zone. So this means this won't be your time zone, it'll be the patient's time zone. And the pay structure for this position is $20 per hour plus monthly bonus opportunities.